psoriasis, it's close enough to kind of making that step of becoming really something that's treated as a systemic disease. And I don't mean just systemic inflammation, but really a systemic disease that involves the skin, involves systemic inflammation, but involves also mental health.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
You know, Hadar, I'm doing pretty well, but some days just seem to have a mind of their own, don't you think?
I know. I really wanted to share with you something that's been on my mind for a long, long time, and that is psoriasis. Because we've had people here talk about psoriasis, and we had people talk about the mind-skin connection, but I feel like we want to really kind of zoom in today on that connection and psoriasis. That's been on my mind. That's really been on my mind.
You're going to do this all day long, aren't you? I can already tell.
If you don't mind, I will.
Oh, gosh. Well, let's be mindful of that comment. And we're going to introduce our speaker because he is really focused in on the science of the mind-skin connection. This is Dr. Fabrizio Galimberti, and he is an assistant professor at the Philip Frost Department of Dermatology at the University of Miami. I think you know those areas pretty well, right, Hadar?
Just down my alley.
Yeah, that's what I thought. And he's interested in the impact of inflammatory conditions on the psychosocial and biochemical health of patients. I think that's very interesting because he's interested in this connection of inflammatory cytokines. I know we're going to get into this. And he's particularly interested in autoimmune conditions and autoinflammatory conditions like psoriasis, lupus, dermatomyositis. Welcome, Fabrizio, to the podcast. We are super excited to talk to you.
Oh, excellent. Thank you guys for having me here. So it was not just the two of you that had psoriasis on your mind today. It was also my mind. And I'm glad to be here to chat with you about this.
Excellent. And you know, Fabrizio, I do think it's worthwhile to spend a minute about your path because you're clearly a star in your training as a person who witnessed you kind of bloom into the great clinician you are right now. You had all the choices in the world, and yet you decided to pursue more scholarly activities. Maybe you can discuss kind of your path and why did you end up practicing what I call scholarly medicine?
Yes. So thank you. First of all, I would like to say that Hadar was one of my mentors during my residency since I trained University of Miami as well. You know, it was kind of interesting for me because I approached medical school after my PhD, which was in molecular biology. So the moment that I entered medical school, I always thought that I was going to do some sort of research down the line. I wanted to see patients, and that's why I entered medical school. But the reason why I chose dermatology and in specific scholarly dermatology was there mostly because I wanted to kind of see if I could push the limit. And what I mean by that, I wanted to take care of the patients in my room, but I also wanted to see if I could take care of the patients that were not necessarily in my room. Before teledermatology, it was kind of hard to do that. Now, perhaps you can help patients in remote parts, but your time is limited. So you can only see X amount of patients per day. But when you do research, when you make observations, when you come up with little hypotheses and test them out, really use the scientific methods in dermatology, then your work can reach unlimited number of people, number of patients. And that's really kind of what motivated me to do scholarly medicine. The idea that I could help the patient in my room and perhaps help a patient who was across the world and I would probably never meet personally, but somehow maybe my little observation down the line was going to able to help that person.
Yeah, I think that's so true. And I think, Raja, you would agree that I know it inspires me every day to kind of wake up and think, doing that kind of thought of the impact beyond my next patient. Mm-hmm. So good. I'm always curious to hear the stories, and I completely agree with you. And one thing I want to add, at least on my part, it's a lot of fun. You know, you keep thinking, keep scratching that old potato up your head and kind of saying, all right, what's next? What can we do better?
Speaking of potatoes, let me just say, I just want to also first of all, thank you, Fabrizio, for giving us a little insight into your journey. Does anyone have a linear journey into dermatology that's really passionate? I feel like we all have these tortuous paths, and it's just fun learning about all of our paths. So
absolutely.
That was a great start.
Yes. So speaking of potatoes, what I wanted to do is dive into our topic. And perhaps, Fabrizio, you can give us a bit of a background into how you got involved with this and why all of a sudden we feel today that psoriasis is a systemic disease more than before. And even on top of being a systemic disease, why is it a psychiatric disease almost?
Yeah, so, this is something that kind of caught my attention over the last few months. And the reason for it is that, we all see a lot of patients with psoriasis, and we're now comfortable or confident in that we're probably going to be able to clear the skin. When we look at clinical trials now, we talk at PASI 75, 90, PASI 100. So we know that we can target their skin, we can make their skin better. But many of them, even when their skin gets better, still might complain about fatigue. They still might complain about having depressed mood. And if you go in the literature, I've always been fascinated by the kind of cycle of depression, stress, and psoriasis. We can all imagine how having psoriasis will probably can lead to you being stressed, perhaps being depressed, and there's great data showing that. And at the same time, there's great data showing, and even anecdotal data from your patients every day, that when they get stressed out, when they feel more depressed, when there's new stressor in their life, their psoriasis flares. So clearly the connection was always there for me, but I never really fully understood, was it a bidirectional really type of relation between the psychiatric component, the depression component, the fatigue component, and the skin, and perhaps was systemic inflammation playing any role in this? So I'm sure you too, Hadar and Raja, you've seen patients with psoriasis who, even when their skin got better, they still tell you that, my skin is 90% better, but I don't feel 90% better. Has that happened to you guys?
Oh, yeah, absolutely. And I feel like mentioning PASI, as I was kind of contemplating as you were speaking, that really it's a surface area kind of measurement. It's really kind of measuring what's on the surface, not to be too poetic, but it doesn't really go beyond to what else is happening. So certainly I've had patients who their skin improved, but they still seem, something else was missing for them to kind of go back to how they were or how they thought they should be.
Yeah, I think it's a really important point because we think of PASI 100, 100% clearance of the skin as the pinnacle of what our treatment should be. But I think you raise such an important point, Fabrizio, because it's not about just the skin. It's about the internal experience of psoriasis, because there is one. And I know you're going to delve into that more, but we can go, and we joked about this before we started the podcast, we can go beyond PASI 100 because now you're talking about going beyond the skin.
Correct. So, we joked about the fact that, maybe we aim for PASI 110. That's not quite doable.
Yeah, right. Exactly.
But perhaps we can make the patients feel so much better that they feel like they have a PASI 110 score. What caught my attention is that in the literature now, there's quite a few reports looking at effect of biologics on fatigue. And really putting your patients on biologics can change how they feel in terms of their fatigue beyond just how they feel about their skin. Now, routinely when we see patients in dermatology, perhaps we don't have the time to dwell into their psychiatric comorbidities and really their mood. But we all know that patients with psoriasis have an increased risk of depression. But additionally, there's quite a stigma associated with psoriasis. These patients sometimes feel depressed because they feel like they're going to be seen and classified by others in certain ways because the rash is visible. That's something that it's hard to hide in some cases. And, that really links to the depression part. I remember reading a, literature on this and really being surprised by how much both kids as well as adults, so both the pediatric and the adult population really has this internalized stigma. They really kind of limit their social interactions intentionally because they're afraid of how they're seen. And I want to emphasize here that that's also pediatrics. So we do have biologics, of course, available for pediatric now, but perhaps when we have pediatric patients, especially myself, I ask them questions, I talk to their parents, but sometimes I fail to really ask the patient, the child, how does this make you feel? How does having psoriasis make you feel? How does it limit on what you want to do? And there's not much actually in the literature quite yet about that approach of how to treat psoriasis. I don't know, do you guys ask your pediatric patients how they feel, or you feel like, we have to talk about the contraindications, the risk, the benefits of a drug, and it becomes a little hard to really dwell into that part of the conversation?
I think that your point is a really, really good one. In fact, I think because they're pediatric, I'm so sensitive to, growing up, I bullied on certain levels about certain things. And so, I'm very sensitive to children that have a skin issue because they're going to be dealing with all kinds of social and emotional impacts. So I actually do ask them how they feel and try to get a good sense of, do I need to escalate therapy beyond just the standard ladder that we go through? But, I hadn't thought about it from a cytokine perspective, but I think that I definitely do ask them beyond just the side effect profile.
Yeah, I absolutely agree. I mean, to me, that's even more important than what I see on the skin, right? Than kids, because, I'll use the example of atopic dermatitis, for example. I certainly, at least one case comes to mind where the child was really not doing well with topical therapy, but what I noticed is that her entire demeanor was affected by it. And same would go for psoriasis. And so if I see, let's say, a teenager that's a little more composed and mature and can kind of handle that, and maybe they can get away with topical therapy. But if I see a child that is really, the weight of the world is on their shoulders just because of that, then to me, that's an indication to really go hard and clear their skin, because I know that I'm probably saving a life or their future. Our life is like a path, right? And we make those little decisions along the way. And I don't know for you guys, but I think my inspiration to become a physician started when I was a kid. And so I can only imagine that if you don't experience the experiences that you were meant to be with a clear skin, then maybe that will change your path. And so when I see these kind of kids who are really, really affected by this, and you don't even need to see them to ask them if they're getting bullied or anything like that. You just see it. Then to me, that's almost the top indication, more than the surface area of the skin.
Yeah, I agree. Dramatically important. And the other thing that is dramatically important is the fact that there is this internalized stigma that even these young children, a priori, they kind of feel that somebody will have a certain judgment of them. So incredibly important, right? But at the same time, I think Raja said, cytokines, and I'm a molecular biologist at heart, and I'm going to say, show me the Western blot, right? Show me that protein level. And, there are studies that actually did that. And I find it very interesting because there are cytokine interleukins association between depression and psoriasis. And that's really something that really got me even more interested and motivated. For example, tumor necrosis factor, interleukin-1, IL-17, interferon levels. These are cytokines that we know well, at least in our world when it comes to psoriasis. But maybe more in the psychiatry and the psychology world, there are cytokines that are known to be deregulated in depression. So here we have the connection, right? The mind-body axis. We tend to treat them as specialists. We tend to treat the skin. But when there is that connection, well, maybe we need to focus on the fact that there is also a mechanistic connection and really start thinking about cytokines as a way to target systemic inflammation and perhaps psychiatric health in these patients, whether they're young or they're adults or independent of their age, right?
Yes, absolutely.
Yeah, I just wanted to make a couple comments there. First of all, where is the Western blot is exactly what Hadar and I grew up in, right? With our mentor.
Absolutely.
Western blots and molecular biology. But I had a question for you, since we're talking about cytokines. We have all of these biologics that are now available. And you alluded to this when we were chatting before we started the podcast, but I wanted you to explore that a little bit more deeply. We have TNF inhibitors, we have IL-17 inhibitors, we have IL-23 inhibitors. We're getting PASI 100, and I know we joked about 110. Are there certain cytokine pathways that we're already targeting that have more of an impact on the mind?
Yeah, so in general, all biologics probably have some sort of, preliminary studies, these show effects on fatigue. But if you really wanted to point out one in specific, probably at this point, IL-23 seems to be the interleukin that most significantly affects the skin and the mind. It's always hard to extrapolate when you do clinical trials in this sense because so many things can happen in a patient life independent of their psoriasis. So that's always kind of tricky. But, as scientists, we can go back to molecular biology, for example, right? And there are studies in mice if you give them cytokines, so pro-inflammatory cytokines, whether are TNF, interleukins 17 or 23. You give these mice these cytokines, you give them a systemic inflammation, and they will start behave depressed. So, when everything is normalized, like in a mouse model, even in those conditions, these interleukins can cause, particularly IL-23, can cause change in mood. So I really believe those data because we have real life evidence from patient, but then we also have the molecular evidence and the animal study evidence. So those three things come together, and that's really probably the highest level of evidence that we have there to rationalize the importance of this mind-body connection in psoriasis.
So I wanted to ask you, Fabrizio, to kind of make a guess or look into the future. How do you think this will change our clinical practice or our approach to patients with psoriasis or patients with depression moving into the future? Should we think differently about how we assess and evaluate them? And you kind of alluded to that and how you interview them. But should we order certain panels that we're not ordering now, or certain screenings? And then should we treat more aggressively, less aggressively? How do you think this will change clinical practice when the right data comes? And it sounds like it's not far away.
Yeah, that's an excellent point, because I think this will have everyday repercussions on our ability to help our patients. And I think the trend is already happening. The idea of what is really mild to moderate to severe psoriasis is changing with time. How the patient is affected with that is becoming more and more important beyond just body surface area involvement. So now that we really want to focus not just on the PASI, not just on the BSA, but also on the quality of life, perhaps we can think about using the Dermatology Life Quality Index as a good approach also on whether we should start a patient on a biologic. But most importantly, I think the idea of having we talk a lot about derm room clinics, for example, where dermatologists, rheumatologists come together for the treatment of scleroderma, dermatomyositis. But personally, I've never been involved in a dermatology psychiatry clinic. And I think that, there's good evidence out there for group therapy, for group visits, for a lot of conditions that at first sight might not have much overlap or might not make much sense for this type of visits. Diabetes, hypertension. Nonetheless, the data shows that when you get people with hypertension together, people with, let's say, other conditions like diabetes together, approach a disease, approach their health and their future, they build strength, they build relationship, that probably changes your cytokine, just having the support group and the ability to share your experience. And I know, Hadar, for example, I know that you're involved in this for when it comes to HS, when it comes to hidradenitis suppurativa. And I think that's incredibly important, because maybe we don't know that yet, but down the line we learn that those encounters immediately lower, let's say, IL-17 or TNF levels. So there is something that we're not able to biologically quantify quite yet, but the evidence on a patient experience is there. And I think psoriasis is close enough to kind of making that step of becoming really something that's treated as a systemic disease. And I don't mean just systemic inflammation, but really a systemic disease that involves the skin, involves systemic inflammation, but involves also mental health.
Yeah, I think I couldn't agree more on the group session idea. I think that we are social animals, right? We feel this, especially coming slowly out of COVID. I think we all realize, oh my gosh, how badly we miss going out. And even if sometimes we go out and we don't like what we see, but definitely miss that community. I mean, I think we even feel it in our profession, right? We don't have these large gatherings, all these meetings that have been canceled and postponed. And we all feel that sort of missing on some level. So certainly we can relate that back to our patients and say, my gosh, if we can leverage that kind of power that we have as a small group or as a community to improve outcomes, I have no doubt that it works. And to your point about HS, absolutely. We see that in our support groups. People feel better. We haven't measured it, but certainly there is an effect there for sure. And I don't know if you know this offhand, but I certainly know that now the HS Foundation, we just came out with recommendations on screening, and certainly in HS, there is recommendations to use a screening questionnaire at least once a year more formally. The PHQ-2, which is basically 2 questions about how the person's feeling, kind of screening them, and it has very good evidence, actually. I wonder if that exists in psoriasis, and maybe we should start doing that routinely, because I haven't been.
I haven't either. I'm not aware of such an approach, but I do think that, as I was saying, that's a time where psoriasis goes beyond PASI scores and starts really encompassing the entire individual. I do want to make a quick point, though, to also emphasize that when I talk about psychiatric comorbidities and involving psychiatrists and psychologists, I'm not just saying to use medications to improve the mental health of the patient. And, usually when we think of psychiatry, we think perhaps of medications, right? And that could be something that could turn away some patients who might not want to be seen by a psychiatrist or might not want to be on psychiatric medications. But listen, the data is there and it's very strong. Things like acupuncture, things like light therapy in the sense of color therapy, climatotherapy, all of these have shown very good evidence in improvement in PASI scores, in really body surface area. So when I talk about psychiatry, I really want to say that I'm really a holistic approach to that, not necessarily just a pharmacologic approach.
Fabrizio, can you talk a little bit more about the color therapy? I mean, we know phototherapy, but what did you mean by color therapy? I wanted you to expand on that.
Absolutely. So, I'm actually somebody who's lucky enough that I can prescribe phototherapy. So I'm happy to prescribe phototherapy. I think it's a very good treatment for psoriasis, very well tolerated. A little time consuming, so not necessarily something that is suitable for everybody. But really what I'm talking about here is something completely different. So there are a few studies out there when patients were exposed to very relaxing situations on multiple sessions with a mindfulness-based stress reduction. So this could be through music, so musical therapy. This could have been through exposed to very relaxing type of humidity control, temperature control, and light control with very soothing light. And just those experiences have been shown to decrease PASI score. So something that can sound perhaps a little different from talking about IL-17, TNF, and JAK inhibitors and all those other things that we're talking about in psoriasis that are very molecular oriented. But when you're talking about psoriasis being a disease that affects the whole body, there's room definitely to talk about all these other little interventions that really go beyond the molecular biology, even though they most likely affect the molecular biology of the disease.
Wow, Fabrizio, you blew me away with this. I didn't expect any less, but certainly I'm going to start rethinking on how I shape the treatment regimen for all my psoriasis patients beyond just screening them for depression and other psychiatric conditions. Thank you. They may need to redesign the room, and I'm going to employ an interior designer in my clinic if I can just get one to join me.
I'll tell you another thing. There's actually a randomized control study that compare phototherapy with and without relaxing music. And you can guess it. Patients who did phototherapy while listening to relaxing music in a nice, controlled, quiet environment did better and improved markedly faster than patients who did not have this access to the mindful approach of psoriasis.
This is fantastic. I have to tell you from an Ayurvedic perspective, because I'm also trained as an Ayurvedic practitioner, people think it's all herbs, but it's not. But one of the things that they talk about is actually using color therapy and sound therapy. I mean, this is fascinating. This is so interesting that you're quoting these sorts of studies. We have a phototherapy unit. I am going to go back. First thing I'm doing tomorrow is to figure out what music we're playing, because if it's going to make an impact, we're going to make the change.
I mean, absolutely. I mean, I know I play music in all my surgeries. Initially, I started it just for fun, but I realized it does put the room in a different mood and the patient's more relaxed and the surgeon is more relaxed. So it's a win-win for everybody. But I thought, Roger, you're going to say you're going to change all the lamps to a different color.
Well, I wouldn't be opposed to that, but perhaps I need to fine tune in the right color too. Maybe that'll be the next RCT that we do.
Absolutely. Fabrizio, thank you so much for joining us for this program. Sounds like we can talk forever and ever about all the different studies that are out there looking at that connection between the skin of psoriasis and the mind of the psoriatic patient and vice versa. Thank you for giving us a little bit of a glimpse into that literature. And if any of you want to hear more and you cannot get enough of Fabrizio, well, Dr. Galimberti is going to be speaking at the Integrative Dermatology Symposium that is going to be taking place in Sacramento in October. And don't miss his talk because he's going to dive into the data behind this and maybe much, much more. Dr. Galimberti, thank you for joining us.
Thank you.
Take care, guys. Nice talking to you.
Hey, Raja, what are you doing this October 22nd through the 24th?
There's only one right answer to that question. The 4th Annual Integrative Dermatology Symposium.
Of course. Now, a question. Are you going to travel all the way to Sacramento, California to meet me in person, or are you going to join virtually in your pajamas?
Pajamas in person. Well, you might see me in pajamas at the Sheraton Grand in person in Sacramento, or maybe I'll be in a Jolly Folly costume. Who knows? But I'm excited to chair this hybrid one-of-a-kind conference with you, Hadar.
Well, man, I do love this unique event our team just put together. This is an event that really takes an integrative approach to common patient questions, also an integrative approach to challenging dermatology diseases. We also are going to cover aesthetics and have practical takeaways to start using in the clinic right away, just when you come back. So, this is the kind of information I just can't find with any other meeting.
So true. And the good news is it's not just for us. It's for practitioners of all backgrounds, and everyone is welcome. Use our discount code IDS25 at checkout for 25% off registration. And you can find us at www.integrativedermatologysymposium.com. Come say hi and tag us on social if you'll be there. And our tag is @Integrative Derm Symposium.
We hope to see you there.